guided kit that we have. Kind of trying to explain what goes on is there's just different depths here.
We're used to that now.
Hey now.
Not you, just in general.
The probe readings that we get on patients, so this is how we can tell whether or not somebody has gum disease. She's actually in pretty good shape here. A few pores, but relatively good shape. X-rays of my patients, just because you can slice the images in a bunch of different directions. So here we're starting to see the lower teeth down here, and make sure the teeth are all healthy, how they're coming in here. But then you can see like the upper molars here, and it's, to me, it's kind of amazing how the roots kind of come around almost the maxillary sinuses. I'm gonna just tell you, like, sedation is just awesome for all the patients that we do this on. I mean, it just makes them super comfortable and relaxed. So at Evergreen Dental, we'll scan your teeth with the CEREC, and these are the blocks. This is actually what a crown actually is made out of. We load it in our machine here, and then this will start milling, and it'll mill the crown. Once the crown's done milling, we'll break it off of the block that we have, and we'll bring it over here to our oven, which fires the crown. It's like ceramics and pottery, so you fire the crown, make it really hard, and then we take it over to a workstation, and we polish the crown all up and get it ready for our patient. And this is where we polish the crowns. Together with the syrup, we can design what the tooth looks like, and then subsequently we'll decide exactly where the dental implant needs to go. And we 3D print these right in the office here. Surgery works is, you know, we position these, and then we'll have some sleeves in my guided implant kit that fit into these sleeves, and there's stops on it, and we can actually get a dental implant within 60 microns of where we design it on our software, so it's super accurate where they go. These are what's called scan bodies, so the day that we place the implant, the day of surgery, but we'll actually use these parts and pieces to scan the implant that day. And so we actually digitally capture where the implant's actually located. And so then we can actually design up the implant and the abutment the very same day. Anyway, this is the guided kit that we have. Kind of trying to explain what goes on is there's just different depths here that we have on the side. So it's, when I design one of these guides, it's specific to each one of these that I'm using. So we'll use only kind of one row at a time. But essentially, like these are blue, so we're gonna, when we start this case, we're gonna put the guide to place like that, and then we'll just grab one like this. And then essentially what we do is we just put this kind of right through that same area, and there's a stop there that causes it, so that's specifically exactly where that implant needs to go. So the reason why I use guided surgery, or I do guides, is it just allows me a more accurate placement of the dental implant. Like when I design it on my software, I can actually get the implant placed within 60 microns of where we design it. And 60 microns is actually 6/100ths of a millimeter, so it's very, very accurate. At Evergreen Dental, we use 3D printing for various things on our patients. This is an occlusal guard that I designed for a patient of ours here. I'll just set it. Yeah, we're designing up a surgical guide here for a patient, and you know, we primarily use guides as it just helps me get the precision of where I want the implant to go. It's just in the perfect spot. Here's the print.
All the way close. Put your head to your left. Close down just a little bit. Perfect.
I love Evergreen Dental.
So we're building a denture here today, and these are wax rims, and essentially what these help us do is capture how he relates. You know what I mean? How these come together, and so that's what we're capturing today. And bite together.